Welcome, everyone. I'd like to call the meeting to order. Morning, everyone. Amber, if you could just get us started, so some roll call here.
Yep, so I will be taking roll call. Good morning, everyone. Ava Bermuda Zimmerman,
Present.
Isha Canada will not be joining us today. Adrian Cochran,
And I am here.
good morning. Sheila Hummel, Sheila Hummel,
Good morning,
good
present.
morning. Thank you. Molly Weston Williamson
Present.
and Justin Zartman.
Present.
Thank you. We have a quorum.
Thank you, Stephanie. Awesome. I'd like to welcome the members of the public to see if anyone's joining us. Welcome, everyone. And to get us started, let's review the March 19th meeting minutes. If the committee is up for review for March 19th meeting minutes, could we call to approve those minutes? And any discussion? Do we have a motion to call the minutes?
Motion?
Okay, now any discussion? I guess not. May I have a second?
I'm sorry, I don't see the minutes. Did I miss them? I was looking through the email.
Oh, that's a good question. Okay.
Steph,
Well,
can you
gonna go and
Mhm.
verify then.
push them
Yeah.
back to the email or throw them into the chat?
Yeah, and then maybe we just do that later in the meeting if you don't mind.
Thank you, Justin. That's true because what I see is different than what you see. Good call.
Okay.
Just give it a second for Steph to put it in the chat, and then that way you can actually take a quick glance and approve meeting minutes.
Thank you.
Stephanie, if you're not able to put them into the chat, we could just display them on the screen. But if you could acknowledge what I'm saying so I know what you're doing. You're on mute right now.
Sorry, yes, I did hear you.
Okay, so which are you doing?
I
Are you putting
will,
them on the screen or are you putting them in chat?
I will share my screen.
Perfect.
We can see your screen.
Thank you.
Okay,
Awesome.
great. Thank you.
You're welcome.
Here we go. We have the meeting minutes from March 19th on the screen. If everyone can take about 30 seconds, it's not that long to just review, and then someone give me a motion to approve. Okay, do I have a motion on the floor to approve the meeting minutes from March 19th?
Motion?
Thank you. Do I have a second?
Second it.
Thank you, Sheila. I'm assuming there's no discussion on these minutes. Awesome. Okay. If no one's opposed, any abstentions, any oppositions?
Mine is an abstention because doesn't appear I was there. I didn't remember for sure for March, so I will abstain.
Awesome. Thank you for
You're
that.
you're listed as in attendance?
I am okay. Then I won't. I can see it. That's why it's so small. Thank you.
Oh, yeah, you are there, Adrian.
Then I withdraw. I withdraw that. Thank
No obsession. No worries.
But I will abstain for that reason. That's why I wanted the minutes. I was pretty sure I missed last meeting.
Okay, so just an abstention. With that, motion carries.
I'm sorry, I don't think you actually asked for all in favor.
All in favor?
Aye.
Aye.
Okay, thank you.
There we go. And motion carries. Really practicing our Robert's rules this morning. Don't worry.
And I test early in the morning.
Thank you. Thank you for that, Stephanie, and thank you for your patience. We're going to pass it over to Jessica to give us our outreach and engagement update. So, Jessica, if you can share your screen and go right ahead and give us your updates.
Thank you. All right. Oh, you know what? Hold on. Let me redo that because I do need to share sound, and I know I forgot to click the button. Okay. All right, great. So, first thing I wanted to talk about, we have some newer Spanish language employer creative. So our partners over at Entravision sourced some local businesses and created videos for us from the employer perspective, talking about Connecticut paid leave and what it means for them running their businesses. So we have two. One from an employee, a general manager at Middletown Nissan, and the other a restaurant owner. And these they came out really great. We've been using them in our Spanish language TV and digital ads. We've isolated the audio for use in our radio ads as well. And then additionally, I wanted to share that we are going to be partnering with a firm called Camello Communications here in Connecticut in this new fiscal year to develop some additional Spanish language testimonials. So, we've been working with Miranda Creative for most of our testimonial development. They've done a fabulous job, but I did feel that there was a bit of a gap with them being able to actually source native Spanish speakers to create testimonial ads for us. This opportunity presented itself with Camello Communications, who is very well versed in this line of work. So we are excited to start that partnership with them, and we'll keep you. We're at the very initial stages of just information sharing and talking about ideas, but we'll keep you updated as we get further along in the development process. Now I wanted to share some new testimonials that Miranda Creative did for us. So let's play these.
To apply for Connecticut paid. I needed to apply for Connecticut paid leave because I was going to be having surgery and I was going to be out for about 6 to 8 weeks. And so to be without that income, it would have wiped us out. I realized my situation qualified for Connecticut paid leave once I was able to talk to our human resources office. It was very easy to apply. It was filling out the form, giving the forms to my doctor, a lot of the things I was able to do online. Why not use it? It's something that's readily available and it's easy. Connecticut paid leave to heal.
So that is the first. So we were, I have two more to share with you. We were continuing with this to care, to bond, to heal, really focusing on the top 3 reasons that people use our program. Oh. Double sound buttons today.
My mom was facing a medical emergency and I needed to go back home to go help take care of her. Connecticut paid leave really did help me not be worried about my finances. I live here by myself in Connecticut, and so I was thinking I was gonna have to decide between a job or staying home with my family. But when I learned that I wouldn't have to worry about finances, it was such a relief. I really got to spend intentional time with my mom while knowing my job and finances were safe. Connecticut paid leave to care.
Our new to bond commercial, actually the production was a bit delayed, so that is not finalized yet, but hopefully I'll be able to share that with you in our next meeting. And then this one I really love. This is an individual who served as a living organ donor and had just made a comment on our Facebook page that was very powerful, that basically said, this program literally saves lives. This program saved my uncle's life because I was able to be a kidney donor for him. And so we said, hey, like, your story is very powerful. Would you be willing to produce a commercial with us? And they agreed. So that's this one. Sorry.
I took advantage of the CT paid leave program to save my uncle's life by donating my kidney. One of my biggest concerns was, could I afford to do this? I realized that organ donation would qualify me for the Connecticut paid leave program in a session with my transplant advisor. Connecticut paid leave made it possible for my uncle and I to focus on our healing journey afterwards. Connecticut paid leave to heal.
So those are our 3 new testimonials, which will be hitting the airwaves and various other forms of media very shortly.
That's great. Thank you for sharing that. Just want to take a quick pause and say that I think it's wonderful between the new partnership with Camillo to again highlight different voices in different languages. I also see, the differences that we have in Connecticut that all bring us together. I love the fact that you picked someone who is single. Typically people assume that paid leave, you're in a traditional household, you're married, you have kids, it's for people who are pregnant, or, you're just seeing the story of the person who's really ill. So I love how you highlighted a variety of circumstances and a variety of people. I think that's great.
Thank you, Ava. Yeah, I'm really pleased with how these turned out. And as I said, really excited to work with Camillo just to bring a different voice. We've been playing around with different ideas for that as well. So not only individuals, but maybe like a community health worker who could speak to how the program has helped, patients that they've been working with and things like that. So I think there's a lot of exciting stuff coming in the future.
I agree. I also do think we did need more Spanish language, but the other
Yes.
thing I want to say is it's nice to hear something positive come out of toxic Facebook.
Yeah,
You don't
well,
often hear that, so.
I have to say, yes, good point, because it's obviously a very easy soapbox for people who, have negative things to say. But we do get a lot of folks that come out and make comments about how this program has really helped them or friends, family, loved ones. And so whenever we see that, we try to, really capitalize on that and see how we can extend the reach of that message. So. Because we didn't meet 2 months ago, I just wanted to give a quick update on events and in-person presentations. I'm not going to read through this list. This is obviously our very busy time of the year. So as you can see, we have been out and about all over the place with our Pride festivals, with Nicole and Maddie doing some in-person presentations for some different groups, like the Women's Empowerment and Business Group. We have Amity Chamber Business Expo coming up next week, which is a new Chamber of Commerce for us to work with. So we're excited to see how that goes. We also participated in the Litchfield Wellness Festival in June. Litchfield and sort of the northern corners of Connecticut on both sides are always a bit challenging just because they're less populous. So there are fewer events and things to go to. So we really focused on making a concerted effort to get into that Litchfield County area and identify some different partnerships and events. And so that was one thing that came out of that. And so, you can see all the different things we have going on, but we've been very busy. July slows down a bit, I think just because it's a vacation month, so there are less events going on, but then it picks up again in August, and we have a number of things on the books for September as well. I also wanted to talk about a couple of research partnerships that we are in conversations with. So UConn, the Rudd Center for Food Policy and Health, which is within the Department of Agriculture and Resource Economics, had reached out to us actually a few years ago. They were trying to secure funding for a USDA grant to study paid leave as it relates to chronic disease and nutrition. Because of the federal funding freezes, it was kind of on hold for a while, but they did let us know that they received that grant. We had provided a letter of support for them. And so they let us know that they received the grant. We met with them to just kind of talk about, what they're going to be looking at. They wanted to know from us what information would be interesting and helpful for us. This is an initial 2-year pilot program, and their intention is to try to secure a larger grant in the future. So we're excited about that. We also just this week met with the Connecticut Center for Economic Analysis, which is run by a professor of economics at UConn. and discussed them doing an overarching a study for us looking at the overarching economic benefits of paid leave. So they're developing a proposal for us to show us what that would look like so that we can see if we can move forward with that. And then we also are working with, or in initial conversations to work with Yale University. They are looking to do a study of Connecticut paid leave utilization and maternal and infant health outcomes. This study would be a coordinated study between the Yale School of Public Health and the Yale Law School Solomon Center. So we've had an initial meeting. We're talking through the details and logistics of data sharing, what would be possible, what would not be possible. So we'll keep you updated as more comes from that conversation. But we're excited to be able to work with some of these great universities that we have in the state to further the research about paid leave. Quick update on employer outreach. John and I met with some of our largest employers here in Connecticut. Because they are the largest employers, they also have the largest volume of claims come in. So we just wanted to gather some feedback on what's working, what are the challenges, any suggestions they had for improvement. We met with the organizations that you see listed on the screen. This all took place in May and the beginning of June. So now we're analyzing that information and we're trying to implement some different things that we can do to help streamline the program even more for employers. We got some great feedback from them on changes that have already been made that have made the program easier for them to administer, as well as some suggestions for things that they would love to see us do if it's possible. And then also on the employer outreach, as you've heard me talk about, I've been doing some outreach every month to newly registered businesses with the Secretary of State, as well as those who register directly with the Paid Leave Authority, and holding webinars every month, kind of CT Paid Leave 101, to introduce those newer businesses to the program. To date, we've had 15 webinars. They're broken up between employers and sole proprietors, and have gotten really great feedback from that. So those will continue. I wanted to give a quick update on healthcare provider outreach because Maddie is out having a well-deserved vacation. So a couple of things under her leadership that have been going on with this initiative. We did meet with the Department of Public Health. They graciously provided us with email addresses of licensed practitioners by profession. So Maddie is now working on drafting some content, which we will then send out via our listserv. So we're excited to have a way to communicate directly with healthcare providers now and into the future. We also presented at the Connecticut Children's Medical Center Statewide Care Coordinators Virtual Forum, which was great because those are the folks that we need to reach. Those are the ones that are, helping patients and their families navigate these challenging times. So that happened at the beginning of June. We also presented to the Family Bridge program for those that work with Bridgeport Hospital and St. Vincent's Hospital. This is a program where folks who have babies at those hospitals have in-home nursing visits. I think I don't remember exactly the number, but a couple of in-home nursing visits right after the child is born. We also have a presentation coming up next week for the Yale Prime Clinic within the Yale School of Medicine. And lastly, we do have a targeted digital campaign for healthcare providers that's been running since late April. And we've had about 40,000 impressions through the search campaign, over 300,000 from the display campaign, and 14,000 through the LinkedIn campaign. And then lastly, I just have hyperlinked here if you'd like to look at it afterwards, a press release that we sent out about our provider outreach efforts. And that is it for my updates. I know it was a bit longer today, but we've been doing a lot, so I wanted to make sure I talked about all that. I also did just want to mention that with the podcast, we're really excited that starting in August, we're going to be beginning video podcasts. So whereas we've previously just done audio, we're now going to be doing video, which will be great. We'll also be able to create a clip for use on social media from each one. And the research really shows that video podcasts create so much engagement, so much more opportunity for, sharing on social media and things like that. So we thought it was the right time to make that transition for our podcast as well. So we'll keep you updated and share some different clips as we get into that.
Maybe some blooper reels.
Yeah. Nancy's a professional. I don't think she has bloopers.
Jessica?
Go ahead.
Yeah, I was going to say, because I know you all plan so well in advance. October 17th is the Money Conference this year, beginning at 8 a.m., full on semi-healthy breakfast and then program, and it will end I think before 2 p.m., probably about 1 p.m. at Chrysler Center.
Excellent. Thank you so much.
You're welcome.
I'm putting that on our list.
Molly, go ahead.
Yeah, I think this is all amazing, and I think I appreciate the rundown of the many, many things, and I'm sure this isn't even the full list of all the things that the team has done in the last couple of months. I was just going to share, I've been advising on the Rudd Center work, and they've got some really interesting initial results out of their sort of multi-state analysis. So I think it just goes to show all the ways in which we're getting not only great partnerships in state focused on the Connecticut program, but also ways in which the Connecticut program is sort of opening doors for nationally relevant research that I think are really worth highlighting and lifting up.
Thank you for sharing that, Molly.
I also want anyone else has questions before I make my own comments? Okay. I wanted to point out, and it's probably already on the radar of the team, that November is open enrollment for healthcare. And, just to get a leg up on the flurry of different events throughout the state for healthcare fairs and really celebrating open enrollment, just to keep that on your radar.
Thank you. Yeah, November is another period of time that there tends to be a lot of different events for us to go to. So absolutely, thank you for flagging that.
Awesome. Well, thank you, Jessica. Thank you, team. Awesome work. We're going to go right ahead and move it to Virginia to give us a CECI update.
Hi, everyone. Let me share my screen.
We can see your screen.
You can see it. Okay, great. So today I'm going to be sharing our numbers from the Q1 update for our Community Education Coordinators Initiative. So this is what they've reported so far. Q2 ended June 30th, but the report is not due until July 31st, so we won't have that data until after the end of this month. So this is just the Q1 information. Just as a reminder, we have 10 CECs we're contracting with this year. So last year we had 7, and so we have 3 new CECs we're working with. The Central Connecticut Chambers of Commerce, the Greater Bridgeport Area Prevention Program, and the Community Action Agency of New Haven. So now we have 2 chambers of commerce that we're working with, which is pretty exciting. This is a map of the CEC service area. So this is the coverage that each CEC indicated that they'd be working in. Each color indicates a different CEC. The orange is where they overlap. So you won't see 10 different colors because the orange, we have like multiple CECs that, for example, are in like Hartford, in the Hartford area. So you can see here, their widespread areas, sorry. They cover about 73 total towns. And then this is where application assistance was reported in Q1. So where someone indicated the residence one. So the total towns is 43 where someone received their application assistance. So compared to the previous map, you can see where the coverage is happening. As you can see here, the large block of blue, that's where Windham Chamber is. They've been doing a lot of work. So compared to the previous map, I'll just flip back so you can compare here. And then this is where application assistance has been happening. And you can kind of see where the concentration is occurring. So like Hartford, you have down here in like Southern Connecticut, and then in the eastern side also. So getting into the numbers, this year we are tracking the level of support that CECs are providing to each person with application assistance. So we decided to break it down into 3 categories. So we have introductory, which is cursory information on Connecticut paid leave was provided to the claimant. So this may be someone who calls on their helpline and asks a question about Connecticut paid leave, like where do I go to sign up? Something like that. Very simple information. Moderate level of application assistance is Connecticut paid leave information specific to the person or their situation was provided and may have included minimal assistance of their application. So it might be a little bit of a deeper conversation, like, you know, I need to take time off for because I'm having a baby. I'm just wondering what I would need to do. Do I talk to my doctor about this? What kind of forms would I anticipate having to get completed, things like that. So it's a more deeper conversation. And then advanced, this is direct assistance with their application, including step-by-step in-depth guidance was provided. So this is someone sitting next to the person guiding them through their application process. So if someone needs help navigating the portal and understanding what the claim process is as they go through it. So the total number of people that received application assistance in Q1 was 187 people. 35 of those people were introductory, 118 were moderate, and then advanced is 28, and then non-categorized is 6. So the non-categorized is because we decided to implement this a little later after Q1 started. So we indicated to the CECs, if you've already marked down the data on the people who've already helped, you don't have to include this new data point on there. So just unless they could remember. So 6 of them were not categorized for that reason. We can see here the majority of the application assistance provided is at a moderate level. Breaking down per leave reason. Bonding leave is that 36 people received bonding leave application assistance. 55 who received application assistance was caregiver leave. Medical leave, which is the largest, was at 71, and safe leave was at 19. And 6, that's the number that not provided, just means they didn't indicate which leave reason was included. Application assistance provided in each language, so in Spanish, 26. And then English 138. So the majority of the application assistance provided has been in English with some Spanish included. And then into total events and activities conducted by CECs by event type. So we have community event, networking, presentations, tabling, training, and workshops. So for a total of 224 different events. Our largest is presentations and tabling. So I wanted to just clarify that with like presentations and tabling, a lot of these organizations are piggybacking off of their own events. So for example, at a Chamber of Commerce, they may have a weekly or monthly meeting with chamber members. So during that time, they're going to be doing presentations each of those months. So it's a reoccurring event that happens in which they're sharing Connecticut paid leave with business owners. Tabling, that's another thing. A lot of these CECs leverage going to farmers markets, which is like either weekly or bi-weekly event. And so they have a permanent table there that they go to and they set up Connecticut paid leave information, sharing information with the general public. So that's why those numbers are a little larger, but they also do other things like larger community events. Make the Road does like a health fair, networking. Some of the CECs, like for Center for the Latino Progress, they go out into the community and they go to businesses and they just share information with the staff there or the employer, the manager during work hours. Some of them do trainings like the Alliance. They do trainings with their member centers and for their advocates on Connecticut paid leave. And then some of them do like workshops, which is a little bit more in-depth like training process rather than just one presentation. Does anyone have any questions about the data before I move on to some of the work we're doing this year? No? Okay. So yes, Molly.
So I was just going to ask in terms of, you know, now that the program's a little more established, the numbers that we're seeing about number of claimants directly assisted, which I know we should contextualize with the people who are being touched in other ways. Are those numbers sort of like roughly where we were hoping they'd be? Are those lower? Are those higher? Like I'm curious about um given that those are extremely salient and valuable to the people they help, but they're not super giant numbers for having a bunch of different partners. So I'm curious if we have a sense of sort of if that's where we're hoping to be, if we're hoping to go higher in the future, like how we're evaluating those numbers.
I would say we would want to see the numbers be a little bit higher in this quarter two, just because we have 3 new CECs that during quarter one, we do expect like there's a grace period where they're getting their program up and running and they're starting to network and get the, advertising that they do application assistance. So I would expect after quarter two to see increases there in the number of application assistants and the coverage. I think we're not, and correct me if I'm wrong, we're not so worried about like the number, but the coverage. We want to make sure that there is accessibility to application assistance throughout the state. So as you can see with the coverage map, we do have some areas that the application assistance is not occurring. So considering how, in future years we ensure we're covering those population areas so people do have access to application assistance and ensuring that there's nobody falling through the cracks there. So I guess my answer is there's always room for improvement. But yeah, I expect there should be an increase after the newer ones get their feet underneath them. I'm interested to seeing what quarter two comes around, and then we'll be discussing like after we look through these quarterly reports. We're going to be meeting, and I'll talk about this in this slide, but we're going to be meeting with each of the CECs, not only in site visits, but in a mid-year touch base to discuss like where they're at, what the activities they're conducting are. Their application assistance strategies, things like that.
I just wanted to jump in too and add that I think, we have seen like year one to year two, we've already seen increases, right? So I think that it's also as the awareness grows, we know that United Way and AFLAC have been providing our one sheet that shows the CECs and where people can go for application assistance more regularly. We've also, just maybe 2 or 3 months ago, launched the digital campaign informing folks that there is application assistance available. So I think that in some ways it's just continuing to build up that awareness. I do agree with Virginia that we want to see the numbers increase, but I also feel confident that as awareness of the program grows, that's going to naturally happen. And then I also just wanted to note that, as Virginia said, we are cognizant of the fact that there are some gaps geographically. So what I failed to mention in my update is that our whole O&E team got together in person last week for just like a day-long strategy session to discuss what we want to accomplish in this new fiscal year. And that was one of the things that we focused on was how do we address these gaps? So that is something that we're, very conscious of and trying to work through how we can make sure that anybody throughout the state who's going to need assistance, if it's from a CEC or not, there is a way for them to get that.
Thank you. Going on to our auditing process. So the purpose of this process is to ensure that the report activities are being conducted as stated and to ensure funds are being used appropriately. So this is our second year of the program. We want to incorporate a process to ensure that the work that they are indicating in the reports is happening, and to do our due diligence to ensure that funds are being used appropriately as indicated. So our current strategies, we implemented a form to be included monthly with each monthly invoice that gives a summary of the work completed for that month. So this is currently implemented. So they indicate the events that they attended that month, how many application assistance they also did that month, and then any other additional activities that they completed for like marketing or something like that. So we get that on a monthly basis. It's just a one-pager form. We try not to overburden them with too much reporting. So we kept it more high level, but it's to also provide like a justification for their invoicing. We are also conducting site visits to an event or outreach activity that the CEC will be conducting. So we are currently scheduling those now. So that will entail myself going out into the field, basically where the CEC is at, and observing them and the work that they're doing. So we can see if they're tabling, for example, as I mentioned earlier, a farmer's market, I can go there and see them at the farmer's market, talk to them, and kind of get an idea of like how it's going, like in person. Then we're also conducting mid-year touch bases with each CEC. So once we receive the Q2 reports, we'll be reviewing those and then scheduling a more formal meeting with them to discuss their work plan activities, their outreach efforts, any successes or areas of improvement that we've noted. So this will be very much focused on their work plans and the work that they've done for the first 2 quarters and where we think they are at and where we think they could improve. And then additionally, we're going to be doing randomized requests for evidence based on work plan activities. So again, after the end of Q2, when we look through these work plans, we're going to be randomly selecting work plan activities and asking for evidence for those work plan activities. So for example, if someone indicated they're doing a social media campaign in their work plan, we would then request evidence for that social media campaign, whether that's invoices for paying for online advertisements, screenshots of the social media campaign, things like that. We would provide with them whatever we select, like examples of what evidence we're looking for, so what would be adequate. But again, this is another way for us to see which, like, confirm that the work that they say they're doing, they are doing. So this is part of our auditing process. Again, this is just to like cross our T's and dot our I's. And make sure that the funds are being used appropriately and that the work that they say they're doing, they are actually doing. So a little bit more effort this year than last year, but I think this will also provide us with some good examples of things we can also share about the CECs and like the work that they're doing and to promote them. So does anyone have any? Oh, sorry, Jess.
Just wanted to add really quickly to that first bullet point that Virginia talked about. I just want to be clear, it wasn't that we were not collecting information on their activities for invoicing previously. It's just that we wanted to implement a form that would standardize the way that they provided it to us, as opposed to everyone kind of having their own way of indicating it on the invoices. So I just wanted to be clear that we've always been, making sure that they're providing evidence and backup for what they're charging us, but this is just a way for us to make it really easy to kind of look across each organization and compare activities.
Yeah, thank you. Sorry, I didn't specify that. Yeah, originally, so just for a little background, we don't have a formalized like template that they have to use for their invoices. They submit whatever the invoice template that they already use for their organization. So when it comes to the description of services on the invoices, sometimes one CEC will provide more detailed than another. So it became kind of hard. It kind of flagged like this is inconsistent between each organization, what they're putting on their invoices. So like Jess said, to standardize that, we came up with the 1-page form to include. So there's also a benefit to that too. So then we can compare those to their quarterly reports also to see if there's any inconsistencies. So it's just another way to ensure that the work that they're doing is what they're doing. So any questions about that or anything about the CECs in general? I'll probably have some more information like once Q2 comes out. We're pretty excited about the mid-year point and seeing like what the work's being done and what the new CECs have been able to do. And then also touching base with them in person and talking to them about their work plans. So I'll stop sharing. Thank you.
I don't see any hands up right now, but I do have some questions. So for when folks call in and have questions, and maybe Aflac is not going to be kind of holding their hand through the whole process and making complaints, etc. When people reach out phone in, whatever it is that they might be asking. Is there someone on the other line or through social media answering, saying we can refer you to one of our community educators to kind of take it from there and hold your hand?
So just to jump in, so I want to be really clear. You can always file a claim by going either to our website and going through the portal or by calling to AFLAC, and they will walk you through the claim. There are people, though, who may have a technology gap, so they want to do it online, but they don't have the computer, or they may have they're not necessarily ready to file their claim, so they're not prepared to do the full claim process online, and they have sort of higher levels of needs. So if they submit an inquiry to us through our contact us on our website saying, I need assistance or I need help, the United Way team can provide the one-pager. Or they could go to our website and look, find the one-pager there. Or the AFLAC folks can say, look, if you're looking for kind of more personalized one-on-one step-by-step instructions or assistance with getting to a computer or whatever, they can do that. So, it is intended to meet people where they are. The customer care advocates at AFLAC get thousands of claim calls a week. So they are absolutely a resource, but they're not necessarily able to spend, 45 minutes on the phone walking through all the different permutations and, hey, do you want to do caregiver leave and then bonding leave, or do you want to go straight to bonding leave? That kind of thing.
I think you answered it. So I guess the answer is yes, AFLAC and other team members of the paid leave team do have the training to say, or it's part of the protocol to say, if we can't meet you where you're at electronically, or if AFLAC on the phone, here is this other option. And I'm assuming they have the list of the different CECs.
Yes.
Awesome. My other question, connected to CECs, but not on the application side, more on the testimonial side, tethering Jessica with Virginia here. The CECs, looking at that list, as they should be, are trusted messengers or people in their organizations in the community that, from what I saw, have been around a long time. Is it possible, as part of the training that you give them and that relationship, to say, look, if you have a case, a person who has a very good story, could you just mention to reach out to us if they feel willing and wanting to share their story? And I frame it that way because I know these are very sensitive scenarios, and it's not appropriate to ask an individual, we expect you to share your story after we help you. But I think through those trusted messengers, just putting just a wide blanket out there of an option, maybe we'll get some organic testimonials that would be useful for the outreach.
Yeah, thank you for that, Ava. We definitely have told them that. So in our in-person training that happens in January, we do a whole presentation on what we do for outreach, and we talk about how testimonials are super important. And we've given them like a copy of the testimonial card we use. Just to, another thing that we were kind of bouncing around for our work, especially with Camelo, is maybe having a CEC do a testimonial and talk about some of the folks they've helped. So if it's not comfortable for some of the applicants to actually talk about it, with permission, of course, would the CEC be able to talk about, so-and-so that they helped through the process? So we're thinking about a lot of different ways that we can utilize our CECs in the testimonial arena.
That's great. That's great to hear. Very exciting. Thank you, Virginia. Thank you for the data and letting us know how it's going. I know it's new, but it looks like you guys are getting some really good traction for applications that maybe who knows what would have happened to them without the CECs and that human connection. So that's phenomenal work. I know we're supposed to be going to old business, but I did see Nancy on, so I just wanted to double check and see if we have any new business with the podcast.
I actually didn't ask Nancy to do a podcast update. She's on PTO today, but she is
Here.
here anyway because she's so dedicated. So we'll have to do a podcast update next time. I just really
No
wanted to share
worries.
about going to the video aspect of it. So,
No
and I
worries.
told her in a side chat, go enjoy your PTO, but she's not listening to me.
Good. She should don't be on here. This is paid leave. If someone should really honor any time, then it's us, right? So thank you for that. Thank you, team. Is there any old business that we'd like to discuss? Okay. Is there any new business that we'd like to discuss? Okay, there's none. May I have a motion to adjourn? I think Sheila's trying.
Yeah, motion to adjourn.
Second.
Thank you. Any discussion? No. All in favor?
Aye.
Aye.
Any opposed? Any abstention for any reason? Okay. The motion carries. The time that we're adjourning is 9:47 a.m. We got some minutes back in our morning. Thank you, everyone. And again, thank you, the outreach team. Phenomenal job.
Thank you, everyone.
Thank you,
Good
everyone.
afternoon.
Bye.